We have all been there. You're having this patient with massive hemorrhage. So you apply the tourniquet, you guard the airway, and you drive very fast, thinking that you're saving this patient. But inside the patient vein, an invisible wall is being lost. Mostly it's not about the physical injury that is gonna kill them, but it's the chemistry. Today, we're talking about the lethal triad of trauma death. Today I'm going to explain to you why you can have this patient with perfect vital signs on the monitor, but still before you arrive at the hospital, they're dead. And most importantly, I'm going to show you how you can prevent this. My name is Pathophysiology and this is EMS-AFRICA. If you're new to this channel, kindly subscribe. To begin with, let's define what is lethal triad in trauma. Lethal triad in trauma is defined as a medical condition representing the intersection of three physical states. We're talking about hypothermia, acidosis, and coagulopathy. What kills this patient is not about the injury itself. How the body responds to this injury normally creates a downward spiral. In this vicious cycle, one component worsens the others. And if you don't intercept or if not interrupted, the mortality rate approaches to 100. Let's look at hypothermia. What normally causes this in the pre-hospital? One of these is the exposure or the environment. The second cause of this is through the loss of blood. When the patient loses a lot of blood, we also have the loss of thermoregulation. The third common thing that can cause the hypothermia in the field is you giving cold IV fluids. Some of the recommended intervention in the pre-hospital, you want to, one, strip and flip. In this, we mean you need to remove the wet clothes immediately. Two is passive rewarming, where you can use the thermal blanket. The third intervention you can do is active rewarming, where you can apply the heat packs to the axillary or the growing region. The other intervention is ambulance environment. You want to ensure that you set the heater in your ambulance to the maximum setting. But also what you can do is you can give this patient warm fluids. Now let's look at the other side of the triangle, that is acidosis. What will happen here is when the patient gets into shock, the body becomes hypoperfused. And as that is happening, the body will turn to anaerobic metabolism. So the results for this is we'll have much buildup of lactic acid. The impact of this is it's gonna decrease the myocardial contractility, and second is it's gonna make the enzyme activities lazy. What is the recommended pre-hospital interventions for this condition? One is you want to stop any hemorrhage. Either you're going to use that by direct pressure, either you're going to use the homeostatic dressings or a tourniquet. Stop the leak. Because the more they bleed, the more they get into shock. The second intervention that you can do is passive hypotension. To achieve this in the pre-hospital, you want to target a systolic blood pressure of between 80 to 90. Or you have a palpable pulse, whichever comes first. To add on the intervention in this, you want to avoid over-resuscitation. Remember, too much of the fluids dilute the blood and worsens the acidosis. Last intervention that you can do is support the ventilation. You want to ensure there's adequate oxygenation, but again, you want to avoid hyperventilation when the patient has head injury or brain injury. Let's look at the third component, and that is coagulopathy. Some of the common cause for this is the dilution of the blood. Mostly you cause this by giving much fluids to this patient. Another cause of this is failure of the clotting cascades, mostly caused by cold or acidosis. The impact of this is the patient will keep bleeding even from the minor injuries. And this is happening because the blood cannot clog the horse. What are the recommended options that you have in the pre-hospital setting? One of the first strategies you can do to fight this is you can give the tranexamic acid or TXA, and the dosage is 1 mg, that is IV or IO, and you give, it's recommended within the first 3 hours of the injury. The second strategy that can be used is the blood fast strategy. If you can give this patient blood, we can recommend it the whole blood or plasma if available. If you can limit the saline, the better. The next strategy is keep them warm, keep them peak. Protecting the temperature and supporting the blood pressure is the best way to support the clotting process. So let's look at emerging concept, and that is the lethal diamond. In this, we're talking about hypocalcemia. Remember, calcium is the glue of the clotting cascade. The risk factor for this comes especially when doing blood transfusion. Some of the citrates used in storing of the blood products binds with the calcium, patient's calcium. That's why you need to be very careful doing blood transfusion out of the hospital, and you need to closely contact your medical director. And most of the time, the use of calcium gluconate or calcium chloride is highly recommended. This helps to support the heart and clot functions. To summarize our topic is, you as you're managing this patient, just don't focus on the injuries, but you also want to think of how the body is going to respond to these injuries. It's important for you to recognize any of the 3 very early. We say don't wait the patient to be cold and blue. Our 3 takeaway home points here is stop the bleed to stop the acidosis. Second is keep them warm to protect clotting enzymes. And third, give them tranexamic acid or blood early. Avoid excessive saline. Thank you for watching. It's my hope that by doing what we just discussed, this will help you to ensure that you deliver this patient to the emergency room in a stable condition than you've done it before. Thank you very much, and if you've not subscribed to my channel, kindly do so. Thank you for watching. It's my hope that